So, good evening, everyone, and a very warm welcome to the opening session of the Healing Arts Encounters in Arts and Medicine here at the Charité Berlin. My name is Lukas Weihreis. I'm a curator and an educator, and it's both a joy and a privilege to continue hosting this dialogue series, an initiative of the International Society for Arts and Medicine, which I had the honor of co-founding together with friends and colleagues and collaborators here at the Charité. So the series, have you been here before I continue? Is this the first time that you're joining the Healing Arts? You've been here before?
No.
First time, yeah. Hello. You've been here before, yeah, I remember. So the series was founded, I think, 3 years ago on the conviction that has, or on a conviction that has only grown stronger with each encounter, that art and medicine are not separate worlds, but parallel modes of caring, of knowing, and of transforming, both concerned at their core with the human condition. So here we come together not to romanticize healing, but to question how it is imagined, how it is taught and practiced, especially in a time when both art and medicine are navigating crises of meaning, of trust, and of attention. Each session of the Healing Arts opens a shared space, one that welcomes complexity, the senses, and uncertainty. It's a space not for conclusions, but for conversation where we might reimagine what healing feels like when we see, listen, and think otherwise. Tonight's session was originally conceived as a dialogue, like every session is planned as a dialogue, this time between Dr. Mike Rüb and the artist and filmmaker Thuy-Han Nijujan Chi, whose moving image works engage in the intersection of memory, trauma, and the political body. Unfortunately, Han fell ill and cannot join us this evening, and we send our warmest wishes for her full recovery. We will nonetheless continue the conversation she was meant to be part of about the power of cinema to teach us how to see and perhaps even how to heal. So our guest tonight, Dr. Mike Rüb, is uniquely placed to guide us into this terrain. His work perfectly embodies that intersection between seeing and feeling, between knowledge and narrative. Dr. Mike Rüb is a psychiatrist at the Charité and a visiting researcher at the Institute of Medical Education at LMU Munich. He earned his doctorate on cinemeducation, which we'll learn about more tonight, exploring how film can teach empathy, perception, and moral imagination in medical training, and received the 2024 LMU Teaching Innovation Award for his project M23 Cinema. Together with Charité students, he is now developing Cinema Charité, a format that integrates film as a tool for reflection and dialogue in medical education. And beyond the hospital, Dr. Rüb coordinates the Medical Arts and Humanities exchange at the Locarno Film Festival, fostering transdisciplinary dialogue among students of medicine, film, and the arts. He also founded the Public Health Film Festival in Munich and serves as a trustee of the Global Health Film Festival in London. His work raises urgent and also poetic questions. What can film teach medicine about the human experience? What does it mean to look, to really see in a clinical context? And how can cinematic storytelling help future doctors cultivate empathy, not as a sentiment, but as a skill? So we will begin tonight with a short presentation by Dr. Rüb, followed by an open conversation between us, and as always, an open exchange with you. So if this is the first time that you're here, this evening very much lives from you guys, from the conversation that we have here. This is a space for really every question. You don't have to be shy about your questions. This is the moment to actually enter into a dialogue. And today we are in a particular intimate setting with the amount of people here. So do use the chance. Maybe actually before you continue to quickly read the room, Who of you comes from the medical background who's now in the room? This one. And mhm. With an artistic background? And something again totally different, which is sociology. Okay, yeah, so humanities, who's from the humanities? That would be you then. Yeah. Beautiful, but that's the idea. Usually we have two speakers that what happens here on stage, this transdisciplinary dialogue, also happens in the audience. So I also use the chance also today with so few people that talk also afterwards to the ones that are in the room. So thank you all for joining this evening, for your curiosity, your attention, and your presence actually here in the room today, and also our online participants in this ongoing dialogue between art and medicine. So let's begin. The mic is yours, Mike. No, sorry, not Professor Dr. Anne Berghöfer has something important to say. Founder also of the International Society for Arts and Medicine for many, 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 many years here at the Charité, dear colleague. And also for those of you who are might take credits from the university, she is the one, the professor to talk to. So Anne, on that behalf.
Thank you, Lucas. Just, good evening from my side also. I just want to say some housekeeping things regarding the rules for achieving the credit points. It is necessary that you participate in the lectures in person here or online. Our assistant, Jakub, will recognize whether you are online participating or not. And after each event, you write a short reflection on the event content and send it by email to me, anne.berghöfer with OE @charité.de. And after completing the lecture series, you have sent 5 short reflections to me. You send a 6th to me with an overall reflection of your impression over a comprehensive reflection over all events. And then you receive the certificate of 1 credit point, which means, as you know, 30 hours workload are corresponding to 1 credit point. Just this from my side, and there is no time pressure. If you want to write something, I don't forget your work over the month. So if you send it in next spring, this is also fine for me. So, okay, then the stage is Mike's.
Mal kurz bei Zoom die Präsentation freigeben. Da sind wir der kleine Zwischenschritt.
Hi, everybody. Thanks for coming to this cozy lecture hall. I think we need a few seconds.
Das hier will ich jetzt mal. Kann man vielleicht hier runterpacken.
Hi. As Lucas said, I'm Mike Rüb. I'm a resident psychiatrist over here at Charité at the St. Hedwig Hospital, and also a guest researcher at the Medical Institute of the Institute of Medical Education at LMU Munich. And I just recently moved from Munich to Berlin. And I'm talking today about cinemeducation. And before I tell you what cinemeducation is and what I did in the last couple of years, I'd like to show you a trailer of one of the main projects in Munich. Welcome to the cinema. This is the trailer how we advertise and start every cinema evening of the so-called M23 Cinema. That is based on the teaching methodology called cinemeducation. Cinemeducation is a neologism coined by Matthew Alexander, who is a general practitioner in the US in 1994, and just meaning or combining the three words cinema, medicine, and education, and just means basically using feature films, documentary films, or video clips in medical education. And in Munich, with the M23 Cinema and German M23 Kino, we combine a film screening with an audience discussion where we show complete feature films, complete documentaries, and afterwards discuss with the student audience medical topics or socially relevant topics. These are posters that we used in the last couple of years of films. For example, Lost in Face by Valentin Riedel, a really nice and really great doctor who's also a neuroscientist and also a filmmaker who found a patient with prosopagnosia, a condition where you're not able to recognize people by their faces anymore. And he produced this really lovely documentary about this patient. Or, for example, Requiem for a Dream, a film that you might know about addiction, or an older film, One Flew Over the Cuckoo's Nest, about stigma in psychiatry. So we're trying to cover topics that are sometimes not really part of the medical curriculum, and where the students who are organizing the cinema have the feeling they want to learn something in a deeper sense. For these discussions, we don't just have the medical students in the audience. We also invite other health professional students or other students who are just interested in medical topics. But the students also invite other guests for the discussion. And it's not just about inviting physicians, which is the main focus of medical school, learning from other physicians of how to do medicine. But we also try, especially in the last years, to improve our numbers of other health professionals, but also people with lived experience, meaning patients or their relatives, or other non-health professionals, for example, people from law, from sociology, and sometimes even the film team. We're just about to publish a study where we looked into all over 100 cinema events in order to see how good we are, how representative we are. As you can see in most of the cinema evenings, there are still a lot of physicians present, but the numbers are increasing in the last couple of years, and the students are trying their best to also give room for other perspectives. I did my doctoral thesis, as Lucas mentioned, on the topic of cinemeducation. I wanted to know what this whole cinema is about and how you're learning in this environment, what you're learning and when you're learning. Because as a student, I started in my second semester organizing this cinema, and it already existed for 8 years. And I had the feeling I learned so much in the cinema, but we weren't quite sure if people are coming just for watching a free film, and how learning in this environment worked. And this is one of the main results of my research, is a conceptual framework on the M23 Cinema. And I think you don't have to read everything now, but I think what's most important in this framework is the learning methodology, is like what is happening during this event, and how do you learn, which is the turquoise color. It's about reflective thinking. It is perceived as a reflection room by the students who are participating, and it gives them the chance of perspective taking, of multi-perspectivity, understanding the patient's perspective, understanding interprofessional perspectives of the nurses, of the psychologists on a ward. And it also helps them connect medical knowledge or other knowledge with emotional narratives that they can see in a film. In the beginning, when we started this research, we were really afraid that the students are just coming for this free film. So we asked the students in this study what the reasons were why they attend the medical cinema. And as you can see, most of the students came because they have an interest in the film, but also a lot of them have an interest in the topic and in the discussion. And round about 40 or 50% come because they really want to learn something and would like to broaden my horizon, I think is also another way of saying I want to learn something. And maybe a funny thing is that 12% of the students, they came because they were looking for a partner. One of the students who is also part of the medical cinema team said in one of the focus group discussions, at the very beginning, I simply found the film fascinating. I didn't know anything about the discussion, and then I kept coming back because of the discussions. And we could also see in the quantitative data this change in people who are attending more often. You can see in the bottom the people who came for the first time, and then the second time, third time, and so on. And this discussion was the reason for 50% who came for the first time, and then you can see a jump of 18, nearly sometimes 20% for people who are coming more often, which is, I think, which I think is interesting because the people come back because of the discussion and not just because of the film. One of the medical students said, once during my clinical rotations, when there was a patient with a rare disease, then the doctor said, you probably don't know this. And I stood up and I said, yes, actually, I have heard of it before at the M23 Cinema, and that has happened a few times now. And I was trying in my research to understand if there is a perceived impact for students participating in the medical cinema. And we asked this really vaguely at the moment, if students who participated in the M23 Cinema were reminded of the topics or of the M23 Cinema in everyday life, in the clinic or during a university course. And here you can see that the majority of them did. And I'm now having a doctoral student, Sophie Hilbig, who is now focusing in her doctoral thesis on this topic of like long-term impact. What does it mean when you participate during medical school in a cinema education course like the M23 Cinema? And I'm really curious what the results will be like in a couple of years, hopefully, or maybe in 1 or 2 years. We're just about to publish a study on the topic of representation, where gender is also a huge topic. Over the last 20 years of the existence of the M23 Cinema, we had over 230 guests. And as you can see, it's a little bit male-dominated, looking at all the guests, but it's kind of half-ish. But if you're looking at like the guests from academic institutions, mostly the physicians, the professors, most of them are male, which is, I think, nothing that is really a topic of the M23 Cinema, but mostly a topic of the university. Also looking at all the film directors of all the 115 or all the 100 films that we showed, most of the film directors are male. So I think we're also having a bias over here of mostly showing films from male directors. And I think we can discuss this later. Maybe over here in Berlin, we should take a focus on this topic and show more films produced and directed by females. And interestingly, the students who are organizing the cinema, most of them are female. But I think this is really a normal thing because medical school is, the majority of the students are female. But I think it's really interesting to see where we're having a bias and where we should maybe focus in the future with projects like this. And also that this topic of representation has its place in a teaching environment. What makes cinema education innovative? The whole cinema education project is organized by students, for students. it's the students who decide what films they would like to show. It's the students who decide which topics they would like to focus on and which guests they would like to invite. It's for students from the first to the last semester. It's supposed to be an interdisciplinary, interprofessional, transdisciplinary environment where we try to curate the guests as transdisciplinary and interdisciplinary and interprofessional as possible. It is perceived as a reflection room, and it's all about emotional learning, something that is not really present in medical school nowadays. And it's perceived as transformative learning. Lucas already mentioned last year we got the LMU Teaching Innovation Prize with 10,000 euros, which is the highest teaching prize at LMU in Munich. And we also got 2 e-poster prizes from Medical Teacher and Amy. And we are, since last year we helped Vienna to start their own cinemeducation course. We're currently in conversation with the University of Hamburg in helping them to organize a cinemeducation course. And lucky us, lucky Berlin, we have a couple of students over here who are together with me organizing Cinema Charité, a teaching project that we hope get funding for in the next couple of weeks or months in order to have a cinemeducation course here at Charité and in Berlin too. If you're interested in joining the team, let us know. Just talk to me or talk to one of the students sitting over there. This said about the M23 Cinema and about cinemeducation in a medical cinema environment. In 2020, when the pandemic hit, we got funding for the first public health film festival in Germany, which is a still ongoing, really lovely film festival in Munich, where we use our knowledge of cinema education more in a science communication way. So the audience are less students, but the general audience. One of the film directors, Karen Akins, of the really great documentary El Susto that I encourage you to watch if you have a chance, told us during the preparation for this film festival, I know how to tell a story as a filmmaker. You, medics or public health people, know how to tackle a public health problem. Through film, a message can reach the broadest possible audience and maximize its impact on behavior, policy, and culture, which affects our health. And I think this really, I really understand her, and I think she did a really great job in telling this really, and like making it possible for people who are not part of the health community to understand the public health topic about sugar-sweetened beverages, how the industry is pushing Coca-Cola and other like sugar-sweetened beverages in Mexico. And she really gives you this like emotional feeling of like how stupid we are as a society, how stupid our politicians are. And also connecting these topics with health, with public health, with medicine in general. I'm also involved in the Global Health Film Festival in London, which is by far, I think, the biggest film festival on a health topic that I know of. And since last year, we have a lovely collaboration with the Locarno Film Festival at the so-called base camp, and it's a transdisciplinary exchange for international art, film, natural sciences, and now also medical students, where we try to figure out how these different students who are coming from such a different background can be in one room like here and learn from each other and have a nice experience, a nice learning experience. If you're interested, we have a website over there, and also Claire, who's here, has been with me in Locarno this year. And I'm pretty sure I can bring more students next year to Locarno. And we came this year with the question, to Locarno, what films would you prescribe for your doctor's education? Maybe you can think about this question and tell us later. To give you a bit of a broader idea where the connection of film and medicine is happening already, there is this Health for All film festival funded by the World Health Organization in Geneva. I personally don't really like their focus. I think it's mostly based on video clips, on short films. I think they could aim bigger, if you ask me, but I think it's an interesting event, and seeing that even the World Health Organization, are really the most scientific organization in health, in medicine, is understanding that the combination of arts and health or medicine is important, and they're funding it, they're giving money to it. In Basel, there is also a cinemeducation project where they, next to medical doctors, invite film journalists or film critics. There is also, for a couple of years, and I think this is also really promising, I think it's getting bigger every year in Copenhagen at the School of Global Health, the Global Health Film Days in April. And slowly coming to an end, we are organizing a cinemeducation symposium in Munich at the end of next year. If you're interested, just write me an email. We don't have a website yet or anything, but if you write me, I can keep your email in mind. We published a couple of papers and are about to publish more papers on this topic. If you're interested, let me know. And with that, I'm really curious about hearing your questions and starting a dialogue.
Yeah.
So thank you so much, Mike. Camera-wise, is it okay if we stand both here, or should we go to the front?
Maybe go to the front. So
Okay, good.
Check.
It's always fascinating when you get introduced into a whole new topic, which is every day for you, but also completely new for me. Let's start on a very simple and personal note. How did this combination start for you? You studied medicine, so that was kind of clear. Was film always something that you were interested in? Or how and when did it enter your life? And
so I think film entered my life, and when I was 16, 17, there was this really nice. Shall we sit down? Yeah.
It's okay for you guys? Yeah. Can you see us? Yes. Very good. Yeah.
I grew up in the southern part of Germany, in a smaller town, and we had an art house cinema that I really loved. That it doesn't exist anymore, unfortunately. I really hate the people who decided this. And I loved it as a student when I was 16, 17, 18. I think I spent every week over there at a sneak peek. And then I started medical school. Didn't really go to the cinema for the first semester, 2 semesters, because I was in the anatomy hall and doing medicine, studying a lot. And then I found this medical cinema, this M23 Cinema. And after the first attendance, they were looking for new students who were organizing it. And I was like, okay, I would like to do it. And since then, it's I'm here, I'm doing it.
And is there like 1 or 2 particular movies that stand out for you that kind of bring all of this together?
I think I really liked Lost in Phase by Valentin Riedel that we showed, that I mentioned earlier, because for me it was so weird to see a medical doctor producing his own film, and I love the film. The film is really, really good. It's not a bad film, I would say. But there's so many films and so many topics that we covered. We had I think a really not the best documentary, but the topic was really controversial about pedophilia. And we showed a 40, 50, 60-minute documentary about a young Swiss man who has pedophilic thoughts. And the discussion afterwards was nuts. It was crazy because people were so pro, so con, and going back and forth. And the students, in the end, also me, we didn't want to leave. We had to kick the students out. So this was something that I'm still having in my mind. But for example, also when we had a really nice film about Still Alice, about Alzheimer's disease, where we had a packed house and we had one of the most renowned research on the topic of Alzheimer's from Germany, Mr. Haas, visiting, and he came half an hour earlier, was sitting on his little laptop, writing a paper and sometimes looking up how many students are coming. And 15 minutes before, the lecture hall was like really packed, and the M23 Cinema always starts at 7 p.m. And I think he didn't really understood that a lot of students are coming. So he thought maybe 50 students are coming, but it was 300 students who were coming. There was no room for them. People had to leave because it was so full. And afterwards, we had a really, really great discussion. We had a relative, his wife has Alzheimer's disease. We had an activist who has a Lewy body dementia who participated, and it was a really lovely conversation. And afterwards, he went back to his biochemistry department and decided, I want to show a film every semester for the biochemistry lecture. And I met him a year ago again, and he tells me this is the easiest lecture to organize for him, but the grades he gets back are the best, and he really likes the discussion. And for him, I think it was a mind-blowing experience participating in the cinema.
And why do you think film, or like even watching film, because we're not talking about making film, but actually watching film, works as such a good method for medical training or even for clinical learning or training?
So I think you couldn't do medical school just with films. I think this doesn't make sense, but I think it can give medical school and this like emotional touch that we usually don't really have in medicine. You sometimes have it in a bedside teaching if you have a good doctor that is focusing on these topics. But my feeling, especially as someone who's working in psychiatry and doing consultations on other wards, is that I see a lack of empathy in a lot of colleagues. And also I saw it in me studying medicine. And there is actually some research that empathy is declining during medical school. And this is also something that people who are going to a medical doctor often experience and then tell us, yeah, I had this experience, I was as a doctor, but I think this person wasn't listening, they didn't care, they don't have the time. And I think participating in something like the M23 Cinema, or in the future, hopefully here, Cinema Charité, can help to understand that there is a patient perspective, and it's important to understand that the patient isn't just here in this moment, but there is a backstory to the patient. There is a future to the patient, and I think it helps you in providing a better healthcare.
It's actually a topic that came up quite often also last semester. The kind of the losing of empathy, and also in medicine, let's say, I guess in the training, it appears to me as a non-medical professional that objectivity is valued over subjectivity. Yet cinema opens a space of emotional resonance. No? And this is probably what you can kind of work with.
Yeah, for sure. I can totally resonate with it. For example, when I started my doctoral thesis on this topic, I was using qualitative methods, which is not really perceived as a high-end research in medicine. Everything has to be biomedicine. You have to work on experimental research in a laboratory. But I think this more human touch in medicine is really missing, and we need more of it, especially nowadays.
And now I'm thinking about maybe like the cinematic gaze versus the clinical gaze, in a sense of, do you think that the act of watching a film kind of can relate to the act of observing a patient, or is there something we can learn from? Because maybe one of the aspects of the lack of empathy is that there's much less time for doctors to spend time with the patients and not properly looking at them. That's something we discussed here quite often, that there's a lack of time and you don't properly look at something. And it's maybe then cinema, which is all about looking, a way of, kind of relating the two, like watching a film and observing a patient.
I think ideally, as a student, you really see a patient during a bedside teaching, but you can't see every patient as a medical student. It's not possible. The students are coming on a ward, and then as a lecturer, as a medical doctor, you're trying to find a patient that is interesting enough for a student. But with a film, you also you have this patient in the film all the time there. You can reuse it. And also it gives you a bit more of a perspective. You get more information, you really get the emotional touch. And I think the artistic people are they're way better than us in like telling these narratives, in giving us a perspective and giving us a broader picture. And also taking this time of 80, 90, 100, 120 minutes of understanding one topic. We can have it in a lecture maybe, but usually, I don't know how you feel about it, but I really didn't like going to like formal lectures. I think they're too boring in the end. And having these pictures in my mind from films, I can still use them nowadays as a medical doctor.
I'm just thinking, connecting to my introduction, where I said that art and medicine are not just parallel worlds, but they kind of are complementary, and they kind of are both dealing with the human condition. And when I use the word arts, I mean it in the most general sense, no architecture, everything included. But then the arts, with a capital A, and medicine are both kind of practices basically of seeing. No, like as an artist, you're really trained to look properly, or trained as an architect that you really look at a case properly, and that's the same that ideally you should do in the training of a medical professional, that you look at the patient properly. That you don't just read, but kind of look at what's the posture, what does the skin look like, to read more what's in front of you, what they have. That's kind of the superpower of both of these disciplines, is ideally seeing closely.
Yeah, I can totally agree.
Yeah.
Sorry, not disagree.
And what kind of transformations have you observed in students through cinematic learning? Like in what you said, empathy, or kind of ethical reasoning, or self-awareness?
I think what I found out in my research is that most students really just get this perspective of a doctor, of a future doctor. And they lack this information. For example, I remember one quote of one of the organizing students. She said after this topic, this film, Still Alice, about dementia, that she wasn't really aware that it's her job as a medical doctor in the future too, to also ask the relatives how they feel and how she can help them. And it's not just the patient with Alzheimer's disease that she should focus on, but also the relatives around, and also understand where are they coming from, where are they going to. And I think it really can help students in forming their own professional identity as a doctor, in having this reflection room that is not really there, I think, or often not there in medical school, where you reflect critically on what you see in medicine, on hierarchy, on a hidden curriculum, on what is sometimes done with patients, where no one really talks about it. And this is a room where you can really ask the question, or I've seen this I've seen it here in the film, how I've been in the clinic, did an internship for 1 month over there. I experienced it like this. Now I'm asking the patient in the discussion, how are you feeling it, and understanding that there is not just one answer to a question, but there are maybe some answers to it, and none of them is correct, which is something that I think that is really hard to understand as someone who's studying medicine or who is a medical doctor. You always want to have the right answer, something that you learned by heart. Yeah.
Before I continue with my next question, you can already start thinking about questions that you maybe want to ask to Mike or to us. And as I said in the beginning, this is really an intimate space, so there's no shame in the game with regards to the question. No, that's what we're here for. No, listening to what you just said, I'm stuck with this kind of emotional part of filmmaking. because I would say medical training has to discipline emotion. Otherwise, I mean, you don't last a week in a hospital if you don't discipline your emotion. But at the same time, maybe film opens up to to feeling how emotion can be rehabilitated, maybe also as a legitimate source of medical understanding.
I think medicine doesn't work without emotions. I think it's false to say that you don't need emotions in medicine. Especially in psychiatry where I work, I use my emotions in order to understand patients. If I have an uncomfortable feeling, it's my body telling me something is wrong, or maybe I should look into it. It sometimes even helps me to diagnose a patient. So I think I'm arguing for using your own emotions in order to understand patients better and also to understand yourself better. And I think it can make you a better doctor.
Yeah.
And I'm not talking about bringing everything that you have experienced in the clinic home and overthinking about it. And I think this is what you meant earlier.
Yes.
And that you wouldn't survive medicine.
In a way, what we discussed here, because you're dealing with so much reality that like you cannot take everything in with you, otherwise it gets too close. But at the same time, you shouldn't leave your personality outside the door once you enter the room of the patient. Maybe that's a good point to kind of turn to you guys. I can kind of walk around a little bit. Who brave to ask the first question and break the ice? Yeah, Anna, wonderful.
I'm so brave. Yeah. So when I was trained in psychiatry in the 90s, it was, I think, a fashion to be to have extreme distance to the patients and to hide your own emotions and to change your speech, for example, your words. You speak in an elaborated way and create special, and it was completely forbidden to touch patients. That was that time. And I think this was an enormous disadvantage, having this perspective on the work and on the contact with patients. And later on, when I was nearly leaving psychiatry, changing to Charité, to social medicine, I said, okay, forget all this. You anyway leave. And I started to touch patients. If, for example, if a patient was depressive, I put my arm around him and try to calm him or her. And when I was angry with the patient for some reason, I expressed my anger. Yeah. So, and my impression was that this was an advantage, and I came much quicker to the aim and to get some consented decision between the patient and me, how to proceed. Yeah, but I'm not sure. You are now in psychiatry. Did this Haltung change over the time? And was there any experiment to go in the one or the other direction as regards the emotions and the long question? Sorry.
No, but interesting. Thank you for this question, or this also giving me or us your perspective of how psychiatry was in the 90s. Sounds horrible to me. I think it doesn't really sound authentic. And I think it's good to be able as a psychiatrist to do both, or maybe more variations in between. I think sometimes it might be good to not show your emotions, but I think often, at least that's what I experience, and also when I talk to my colleagues in my age or even younger, in the end, the patients are still humans, and often they're lacking a human touch. And I think it's okay to touch a patient if the other person is okay with it. And I was mainly working with young patients having their first episodes of psychosis or other psychiatric illnesses in Munich for 2 years. If I would be this cold psychiatrist, not laughing, being really emotionless, this wouldn't work. I wouldn't be authentic. So, and also my authenticity is a different one than yours and than all my other colleagues. I think it's good to understand who you are and like find yourself, and understand with which patients you have your strengths and maybe sometimes limitations, and use emotions as a superpower, kind of. I think it helps the patients and us.
I'm curious about the different fields in medicine, how psychiatry, I guess, is the one that is most obviously connected to emotions. But I'm wondering whether you have a few examples about other fields where it may not be quite as obvious that emotion does play a role. I would imagine pediatrics or geriatrics also would lend themselves as very rich fields for entering emotions, but I'm sure there are other fields as well. So I'm wondering also about your medical colleagues who are most open to this, and maybe something that has surprised you where cinema can play a role.
Good question. I'm not sure if I'm the right person to answer this question because I'm a psychiatrist and I don't see the other fields anymore so often. But for example, this medical cinema was invented by Matthias Siebeck, who is who's a surgeon. And he really liked going to the cinema, and he had the feeling that he learned something sitting in a cinema watching art house films together with his wife. And then he had the feeling, okay, my students should learn something about it. And we also had some topics, some films about surgical topics. I remember one, I can't remember the film, but I remember the topic of amputation, where we invited a patient who got an amputation and also an orthopedics technician, I think is the right term, for the cinema event. And I think cinemeducation also works on this like less emotional disciplines. And also you need emotions over there. You need emotions in oncology. I think patients are patients, and it's always about humans, and I think we need them. But the thing is, in a lot of other specialties, we don't have the time anymore to really start a longer conversation. And I think in psychiatry, psychosomatics, child and adolescent psychiatry, it's one of the few disciplines in medicine where we still have time to understand patients, and if I want to, I can take an hour, sometimes 2 or 3, if it's really necessary, to understand the patient. And there I have the time for emotions. If I just have 1 minute, 3 minutes, and then I have to write a doctor's letter like this, there is no time for emotions. So we need more time in medicine in order to have more emotions in other disciplines.
There's a question via Zoom from Yuna. How often do you show films concerning mental health issues? Please give examples.
In this study that we are about to publish, we figured out that psychiatrists are the most common or most invited guests that we have in the medical cinema. I think this is by accident. This is not because of me. We have a website. Let's do it like this: M23 Kino, M23 Cinema, m23kino.de. And there is a whole list of all the films, all the topics, all the guests that we invited. And I'm pretty sure you find all of the films that you're interested in over there. And I have to think about, maybe give me half a minute or a minute. But maybe 5%, maybe 10%, but I think it's not more. It's not the main topic. It's really the topic of how we use cinemeducation in Munich is really broad. It just has to be a medical topic or something that is not really covered in the curriculum, and the students want to learn more about it. And then I think it really depends on what you define as a psychiatric topic.
This might be personal, but I was wondering, aside from the answers you got from students, have you had a moment in your career, in your life, where you remembered a movie scene or something that you saw at a cinema education event, and that somehow changed how you interacted with that moment?
Good one. Thank you, Claire, for asking it. I think to answer it in a more general way, I would say the cinema really helped me to listen to patients and try to understand them, and try to not be too judgmental in the beginning. We're trained to in Schubladendenken, to bring patients into boxes. And I think especially in psychiatry, I see it with a lot of colleagues who are trying to put people into boxes, and then they're in this box, and then patients are coming more often, and you're not really open in putting them in another box, or maybe putting them in several boxes. And I think this topic of like stigma, discrimination is something that really I see it a lot in medicine, and it really annoys me. And I think the cinema really helped me to feel it more now when I'm working as a psychiatrist. And I mentioned this documentary about pedophilia before, which is a super controversial topic, but in the end, people with pedophilic thoughts, they exist. And I had an 18-year-old patient with pedophilic thoughts, and I experienced the whole clinic that I was working in as super stigmatizing and not really helpful with this patient. And I remembered back then this cinemeducation event that we had, and this like really crazy discussion about this topic. And I think what I learned from this evening is that people exist with pedophilic thoughts, and if someone is asking me for his or her help as a psychiatrist, I'm here to help. And for me, it was important that this person is having a good psychiatric experience, so that if something is happening or about to happen in the future, this person has a good memory of psychiatry and can still think about us and maybe ask for help when it's still possible. And for example, this patient never did anything to someone. He had these thoughts and he needed help. And he had a lovely mom who was listening and trying to help him, but the healthcare system was extremely stigmatizing. And for me, it was my job then to help him in this psychiatric system to have his human rights to get healthcare. And then I needed to work against colleagues on the ward, other professional teams on the ward, my supervisors, my consultant doctors. And it was really a tense feeling in the clinic that I'm helping this patient. In the end, he's doing fine. He's really doing good now, as far as I know.
I will try to phrase it as a question and not a suggestion. And
both, it's fine.
I may go to a different direction, a bit more the arty direction. You were talking about this power of narration and how this broadens the horizons of using the emotional side by medical students. And I think that this medium of watching cinema is amazing, actually, to do that. But I couldn't help but also think of how, I don't know, like powerful it could be also for medical students to create maybe film. And because I think like filmic narration and being actually the one that makes it makes you really understand this emotion. It's like this process of having to project something, to apply something. And I was asking myself if you could see this possibility maybe of, yeah.
Fantastic question. It isn't just a possibility. There are people in the world who are doing it. There is a Taiwanese professor who lets medical students and communication students produce their own short films about medical topics. And then they use these short films for the next generation of medical students in order to teach them with these short films about medical topics. If you're interested in doing a doctoral thesis on this topic, let me know. I'm looking forward into sneaking into this like microfilm teaching, which is what this Taiwanese professor is calling it.
So, ich gebe dir die Mail.
I couldn't stop thinking about it because I did last semester a film course actually, and it was we had to make a short film, and it had me really into this investing into one emotion and how do you communicate it, and I have super many medical like med student friends, and I thought how amazing it would be if they would have to do this for their practice and for them. So this is why
I think this would help them a lot. It's a lot of effort and a lot of work, I think, but I think it's worth it. And I think doing this in a transdisciplinary environment with art students, with film students, with communication students, I think this would be, I think, a really, really good learning environment, maybe in the future.
Have you ever thought about making a film? And if so, about what?
No, I don't. I think I haven't really thought about it yet. I don't know what I would make a film of. I don't know. Let's see. But I think Valentin Riedel, this medical doctor I mentioned before, I think it's great if someone who is in medicine is able to do a film, and I think we should give people this opportunity of doing it and have some organization, some institute, some possibility, some funding for people to do this. I think this would improve also the artsy field to get more medical knowledge into films, into theater, into other more artsy projects.
I was wondering, because I've worked on a psychiatry as well, actually someone assumed it, how you kind of keep the magic alive on an everyday basis, because I do understand the idea of seeing the patient for the human itself and for being curious and diving into them. But as you said, time is a limiting factor. And I would say the conditions that you as a doctor face, especially when you're starting your trainee phase, are very much not conditioned to allow this kind of interaction. Because I do feel like the boundaries are quite strict, that you are not meant to overstep some boundaries, if that makes sense. And how, for example, touching or giving someone a hug while they're crying, I always felt there was still this code that was not necessarily written down, but existed. Yeah, how you defined your own boundaries with that topic.
Tough question. Yeah, I would say there is I'm not sure if it's really a hidden curriculum or a code or whatever you call it, to not touch patients. And I think you can do it as Anne was doing it. And I'm also doing it sometimes. And I still have this sometimes a bit awkward feeling, but I think it's good to have this awkward feeling because it's also, I'm overstepping a boundary in general. I really have to think if I should do it or if I shouldn't do it, with like talking about the touching. And if I sensed your question correctly, you're also asking about how you were asking about how we keep the magic flowing or happening or over the time, because it can be sometimes really hard seeing all this aggressiveness and these stories that are really sad. For me, I think it's just the small things, the small interactions with patients. I think I remember last week when a young patient with autism that I was seeing in the emergency department for, I think I saw him 6 times, 5 times, I don't know. It was always super aggressive. It was always super stressful for him. And I somehow managed to have a connection with him and send him back home again and not bring him on a ward. And during one night, he was admitted to a ward because he was too aggressive to his parents. And 2 or 3 weeks after, last week, I saw him on a walk around the clinic, and he was coming to me and touching me. And he's not really able to speak, but from his face and how his body moved, it was like a little thank you, like I recognize you, I remember you. And a colleague of mine was standing next to me. We were in a conversation. She was looking at me like, wow. And these are like the small things that sometimes happen. And I think this keeps my magic alive. Working as a medical doctor, maybe. Not sure if I answered all, yeah.
I don't really have a question, but something came to mind. So I'm yeah. I'm not so comfortable talking in front of people, but so I'm a filmmaker myself. I'm a producer, and I actually do have a documentary project at the moment going on. So I'm, beside of being a producer, I'm also like somatic.
Sorry, you're what? I didn't understand.
Producer, like a film producer, like documentaries and advertising. So money and the good part of. And yeah, and I'm also like a somatic experiencing practitioner, like working with trauma therapy. So now I'm combining both of my passions, and I'm about to produce, like, getting funding for the topic of transgenerational trauma, which is like in the media everywhere, like, and yeah. So I was just came up because we have like one of the how do you say, like the woman who brought somatic experiencing by Peter Levine into Germany, and she's 82. And so she agreed also that we can portray her and that we can travel with her. And she made a special weekend education just with the topic of transgenerational trauma, like us in Germany. Yeah, so this is what we want to show, because there are so many people who don't even know that they might carry the stuff from our ancestors, and it takes like 3 to 4 generations to get this out of your system. So, and we're looking also for collaborators and just also want to show the story of transgenerational trauma, personal stories, but then also the science. So we want to yeah, I mean, it's a broad topic, and also we would love to travel with this film, like also for educational purposes, not only for people who pay like a ticket in the cinema, but to make it also free. So yeah, I'm just throwing this in. If someone has some some psychologists or people who are specialized in this field, then I'm happy to collaborate. Even if students want to, yeah, I don't know, do research, or, I mean, it's such a broad topic that, yeah. So.
You have medical students who are organizing Cinema Charité. Maybe they're interested. Get their contact them with the film when it's ready, and maybe
but before, because we haven't started shooting it. We are in the funding phase, and yeah. So
let's talk later.
Yeah.
Yeah, very good input. And as soon as the film is ready, you're invited. Okay. This is an official invitation to when this is going. Thank you for sharing. Anna, you have another question? Yeah. Yeah.
I still have some really practical questions because I didn't understand this at the beginning exactly. This M23, does it refer to some special term in the studies of medicine?
It's super nerdy, and you won't understand if you haven't studied at LMU Munich.
Because we have
and that's-
M23 at Charité, you know. That's the model with the Hausarbeit.
I know.
So this is what I thought.
So the name of this medical cinema in Munich changed over the time. It started with Modul 3 Kino, Module 3 Kino or cinema. And the clinical part of the medical curriculum is organized in modules 1, 2, 3, 4, 5, 6.
As in Berlin, yeah.
Then it changed into combining Module 3 with Module 2. And then they changed it into Modul 23 Kino.
Okay.
And when I took over the organization as a student, it was called Movies in Medicine, and I really didn't like the term movies. So
in which term is it? In which term of the
third year?
Third year.
Third or fourth year. Third and fourth year.
Yeah. Okay.
And I wanted to go back and have a niche, something that the medical students understand, some artsy, art-housey vibe to it. But Modul 23 Kino sounds really boring. So we changed it to M23 Cinema. Okay. I think it's not the best way but people know, the students know what it is, and that's...
Okay. So, and then what is the schedule then? It's a fixed place in the study, in the curriculum. No, it's for free.
It's completely extracurricular.
Okay.
It's free.
And you look for a film that is interesting or fitting in your, and then you rent or buy or whatever. How do you get this film? Maybe it costs a lot of money to rent it or so. Yeah. And then you invite a specialist on the topic, and you construct the discussion round.
Okay.
How is it? This is what I'm interested in. Yeah.
So it's not me, it's not a professor, it's the students who decide which film they want to show. They are organizing the film rights. It really depends. Sometimes it's for free if they're really nice to us. Sometimes it's 50 euros, sometimes 100, sometimes 150. If it's an HBO or Netflix film, it often is like 400 euros. And then we often switch to another film. And the students are organizing it. They're organizing the film rights. We want them to be independent and also have this work. So it's not us providing this work for the students. It's extracurricular. In the evening at 7 p.m., 3, 4, sometimes 5 times a semester. The students decide who they want to invite as guests. It's not just one specialist. It was in the beginning, but then we changed it more into a group of 2, 3, often nowadays 4 people that we invite. In the beginning, it was Professor Matthias Siebeck, the surgeon I mentioned before, who was moderating it. And when I, with a friend, took over, we had the feeling it's a bit stiff. So we told him that we wanted it to be less stiff. And then he was like, okay, then you students are doing it. So we were like, oh, but we have never moderated before, so we don't know how to do it. And he was like, yeah, but then this is a chance for you to learn it. So nowadays, it's also the students who are moderating it. In the beginning, they're super shy. They don't know how to do it. They make mistakes. But they get better and better in moderating a discussion. And what I think is really important for this teaching environment is that we are not really interested in scripting the learning objectives from the beginning. So neither the students who are organizing it nor us as like the lecturers or the professors or whatever, we want the students to afterwards have the knowledge of this and that, or have the attitude of this and that. It's the students in the audience who decide how this event will go. So the moderating student has maybe 1, 2, maybe 3, like starting questions like Lucas had, for example, today, maybe a bit less. Usually we start with 1 question and really like an easy one to the patient or the relative, like what you've seen in this film. Is this something that you experienced yourself in this way, or did you perceive it maybe in another way? How did you like the film? Something really small, easy to answer. And then the questions are supposed to come from the students. And I think the best way of how it works is if there is a discussion within the audience. If you are asking a question, but for example, you are answering the question, and we are also telling the guests to not provide a PowerPoint presentation, which is something, especially the older professors, the male professors, they really are, what do you need from me? A 15-minute presentation? But I really want to bring this PowerPoint presentation about, and we really have to stop them. They know everything, and what they don't know, they don't know. It's not really important. And they are instructed to answer really shortly in short questions and also start a conversation. And this doesn't work always, but I think most of the time it works.
And last question, do the students also sometimes choose something like Dr. House also?
So
you know Dr. House.
Yeah. Who doesn't? Who doesn't? So there are teaching events that are focusing just on Dr. House or emergency room or Grey's Anatomy. We deliberately decided to not focus on series, but on feature films and documentaries, because we want to also push the art house filmmakers. And there are, I think the literature on cinema education is full on Dr. House, emergency room. And we have the feeling you need one, and usually how they are managed is they have one professor who's like really specialized in rare diseases and really likes to present everything, and you really have to be prepared for this specific episode that you're showing. You really have to know this disease and the differential diagnoses, and I think the learning is a completely different way of how you can use Dr. House compared to just showing a feature film and having this open dialogue.
Then there's a comment again online from Hannah Strohmeier. Hello, Hannah. She was a lecturer here, a speaker the last semester. Because we mentioned before the example, if medical students would be able to make films, then it's also a question of crediting. Or you just said the M23 is extracurricular. This is the topic we discussed also last semester. I mean, we have now ODK students here getting credits at the Charité, which is great, and the medical students could get them at the UDK when I was there, but like the crediting point is still completely vague or non-existing, no, for such artistic endeavors.
I think there was a chance for us to do it, but I think then you have a different audience. You have an audience who has to be there. And we wanted to have this like free audience. The people are coming because they're motivated. They want to have a nice evening with friends. They want to see this film. They want to have a discussion on the topic. And for this was much more important to us than getting some credits. But we're thinking about, we're currently thinking about in Munich about organizing a Wahlpflichtfach on video essays, where in a transdisciplinary team, you're producing your own video essays, your small films. And I think for this, credits make sense. But I think you can do it if you want to, but we deliberately decided not to do it.
And maybe our final question is also again online, connects to one that I had, Jana or Yuna. Jana was asking if you ever used films or movies, not only in the cinema education, but actually with patients, or even in a group setting, in order to show something. And that reminded me of, I think when we first spoke half a year ago, which was actually, I didn't tell that, but like about half a year ago when you moved to Berlin, found out about healing arts, you contacted me, we had a phone call, etc. And what I knew, there's a book by more of a, let's say, an alternative medical doctor, Rüdiger Dahlke. It's called The Hollywood Therapy. And he has a whole book where you watch Hollywood movies in order to, do your own therapy. So connecting this to the question of Jana, did you ever use it in the context working with a patient, that you watch a movie together or even talk afterwards about it?
So I haven't done it yet in a proper way, but I know there is research on this topic, and it's called cinetherapy, using films in order to therapize. I think there are some Italian psychiatrists who are using it. I would be interested in doing also research on this topic, but at the moment I didn't have the time. I think, as always, you need someone who's interested, a doctoral student focusing on a topic like this. But for example, on the ward where we work together, some of the psychologists are showing films to the patients, but not with like this learning background in their head, just for having I think a nice atmosphere, something that they do together as a group. And I remember that when we started the Public Health Film Festival, I contacted a guy in Munich who is from I think also a film student, if I remember it correctly. And he collects films and tells you, if you feel sad, you have to watch this film. If you want to feel happy, you have to watch this film. And having this like therapeutic understanding of when to use a film in which situation. Unfortunately, I can't remember his name.
But that sounds like the Hollywood therapy.
It sounds a little bit like it, yeah.
Actually, I was lying before. It wasn't the last question. I have a final question now.
Okay.
But then I'm really never done. Because we talked the whole time about like how the arts, in this case, or for tonight, it's really about filmmaking, kind of affects maybe the medical training. But now let's switch it. Like, what does medicine offer in return to the arts, in your opinion? Kept the easy one for the
kept the easy one for the last for the ending. My feeling is sometimes I'm in the cinema and I'm watching a film, and I have the feeling the research wasn't really done in a proper way. So sometimes stuff is shown that is not really real, is not how it's done in medicine, and sometimes it's done on purpose to exaggerate, for example. But for example, in psychiatry, there is this Elektrokrampftherapie, ECG, that is, for example, a big topic in One Flew Over the Cuckoo's Nest. And it's an old film, I think from the 80s, maybe 70s even, but people still have the whole image of how horrible this therapy is in their head when they are in psychiatry, and then we offer this treatment to them. And it's not the first treatment we would offer, but it's one of the later ones. We still don't really know how it works, but it sometimes works wonders. But you always, or as a psychiatrist, I realized it so often in these conversations, I have to come back to this film with my patients to give them the understanding that what is shown in this film is not how it's done. It's maybe how it was done 50 years ago, but it's not how it's done nowadays. So I think what we can offer the people from the artsy film world is giving more evidence, more real world of like maybe also providing snippets of stories that we are struggling with. For example, we're struggling a lot with like less money, with less time. I think these are topics that are still not really shown in films. I think there is now Late Shift, Night Shift that was shown at Berlinale, which is one of the first films about where you can see a nurse and how a normal shift as a nurse looks like. I think it's really done in a really good way. I've been at a world premiere here at Berlinale, and then one from the audience was like, yeah, so this is a really tough shift and nice done. And then there were so many nurses there that were like, this is how our work looks like. And actually, this is kind of okay. It's often even worse. And also, for example, the topic of schizophrenia, of psychoses, of young people having first episodes of psychiatric illnesses. I still have the feeling there is a lot of stigma in films, in art that I see, especially in films. I think it's changing now because mental health is a topic in the film industry. But I think getting a proper knowledge about what is shown there and how to show it, I think this is something that we as specialists from the medical and health field can provide people from the art and film industry.
Thank you so much for being here tonight. Thank you guys for joining us here in the space. I hope to see you again in 2 weeks' time, I believe. So that we are roughly November 19th is our next session. Join us online for the online audience, and join us here in the space again. Thanks again for taking your time. It was a beautiful introduction into film, which we haven't covered in all these years now. All these years. This is the third year of the healing arts. So this is just the beginning. Thank you so much, Mike. Thank you so much for being here.
Thank you for inviting me. Thank you for coming.